infiltrating the area with local anesthesia, and our patient is excellent. She's very cooperative. She's awake. She's totally awake. Are you doing okay, Maria? Okay, she's doing well. Going, and she's not feeling anything. As you can tell, she's not feeling anything. We are numbing this area pretty good. We'll come back to this area afterwards, after the fluid is absorbed. Once the fluid is absorbed, we can address the cellulite treatment and the hip. There's a bump here. But you see the ass is just for us to take the cellulite off by doing Vaser smooth. Here we are infiltrating the flanks. The flanks is what's going to give her that hourglass shape when we do the liposculpture. And Maria is totally awake. With a local infiltration of the tumescent solution is a very fine needle. The advantages of very fine needles is that the patient doesn't feel anything. It takes us a little bit longer, and we have to do it in successive small steps. This is called the disruptor. This disruptor has a little serrated edges, a little bit of serration here, and it's going to disrupt the fatty tissue. So we have to turn up the suction, insert it very gently inside, and then it disrupts the fat. You go all around it because it's all numb. You already numbed it with the tumescent solution. Maria is doing great. How are you doing? Doing good? She's doing good. Thumbs up. So that's a good day. And here we are just breaking up the fat. Once you break the fat, you can aspirate it very easily without any pains, without any problems. So here we go using the disruptor to disrupt the fatty tissue, and sometimes there's some scar tissue from previous surgeries. She also had some previous procedures done, so that makes it a little bit more challenging, but see, it goes in and out. She's awake. Here we are, we're now sectioning the fat. It's totally numb. It's going to work on making this curved. But prior to that, it was a little bit square. So we make it that it gets a natural curve that it once had. It's local anesthesia. Patient is awake. It's a very simple procedure, relatively speaking, safe. And you can see that we are working on the waist here, okay? And look, we go underneath and do what we call liposculpture. So you sculpt the area. Now we are sculpting the flank. The flank is the waist, also called love handles. As we can see here, please take a look. There is no more love handle. Love handle is gone. It's nice and curvy. You know the back, below the brassiere, you have a little band of fat or tissue. We also take care of that, and this is being done right here. Look. A dog ear from a previous breast surgery, we're going to excise that. So I can use that as a port of entry to sculpt this area. Remember, we did the bottom here, now we're going to do the top. This is the area that you have a bra and you have all this tissue. So the area has already been numb, and now what we do is go over the fat and the scar tissue to render a smooth back with no bumps and no fat. So the fat is being removed. See how the fat comes out? Clear fat, yellow in the tubing. And here we are. Maria, how are you doing?
Wonderful.
You're doing wonderful. Me too. That's a great day for everybody. Go in your limits here, and so we can do a good job. So here we are. And we're done. This is a Vaser device, V-A-S-E-R. What that does is going to render the area smooth. There's an ultrasound at the tip of this instrument. This is a third generation ultrasound device. So we go close to the skin, and then it hits up the skin and gives some skin tightening and free up the fat. And this is actually the best thing for cellulite. Nothing compares to that. It's not permanent. It'll last maybe 2 or 3 years, but sometimes longer. And as you can see, she's all numb. We are going, freeing up the skin from the fatty tissue. And that is a good day because this is going to look very smooth. That's why the name of this procedure is called Vaser Smooth, S-M-O-O-T-H. Doing the arms. We already infiltrated the area, and we're suctioning the fat, as you can see. So that's looking pretty good. This is a preoperative marking areas. Okay. Here we are on the right hip and the right thigh for cellulite treatment and removal of this bump here. So we're going to use Vaser Liposuction. It's a Vaser ultrasound. So look at what we're doing. We're going in between the skin and the fat, and we free up the fat from the skin. So the cellulite is taken down, because that's what it is. And the cellulite, the fat gets pulled up and pulls the skin down. So if you free up the skin from the fat, the skin gets loose. So this is how it's looking, okay? So Maria is awake, she doesn't feel anything because she has local anesthesia, she's doing very well. Very nice patient, very cooperative. And here we are. This is called Vaser Smooth. That's a nice procedure. It's about the only thing that works for cellulite. Yes, it's temporary, not permanent, but it helps a great deal.